had a few perfect heads and the rest he put hair on. That's what they say. Okay, thank you, Dwayne. I'll just start things off. I think Katie Hunhoff may join in and just listen in. But for the purposes of today, there's just one thing on our agenda after we take roll call. And I can see everyone that's here, but for the listening folks, Mayor Nathan Johnson is here. Amy Leon, City Manager, is here. Dr. Mary Milroy is here. In terms of our ex officios, we have Commander Jason Foote, City Attorney Ross Denherter, and Community Development Director Dave Mingo. Brad Bees is not able to be here today, but we will catch him up to speed. On our agenda, and I know that as we catch up, we will have minutes for each of our meetings, and we will be posting those as well on our website. So anything that we do, folks can see any action that comes out of this board if they're not able to join us on Facebook Live. The second thing on our agenda is just a general update and discussion about our COVID-19 response. And I know we have a few things from a staff perspective we'd like to talk about on the ordinance that the City Commission passed. I have a couple things internally I'd like to mention, but Dr. Milroy would like to clarify something first, so I'm going to let her take the mic.
Yeah, thank you so much. I had mentioned to Amy that I just wanted to clarify something. Last time we got together, Nathan asked me to just say a few words. And I just want to clarify what I said about how infectious the coronavirus is. In that the coronavirus that's responsible for the COVID-19 disease that we're seeing, the way that its infection kind of ability, how contagious, is measured by something called an R0. And actually right now they think the R0 for the coronavirus is probably somewhere between about 2 and 3, which puts it more contagious than the regular flu. The thing that we're particularly concerned about is when we look at the death rate. The death rate that we see from kind of our seasonal flu tends to be about 0.1%. And in well-treated places and things, sometimes it's even as low as 0.05%. The really concerning part about the coronavirus is that while it's very new, and so of course the numbers are evolving all the time, it seems that it's about 20 times, has the potential of being 20 times more fatal than the regular seasonal flu. So when I said 20 times, I wanted to make sure I wasn't just meaning 20 times more infectious. It's probably about maybe twice as infectious, we think, but the potential, the difference between the flu at 0.1%, which still causes millions of deaths, is that it could be at least 20 times worse than that, which would be absolutely catastrophic, which is why we're here and all very, very concerned. So I just wanted to clarify that it wasn't 20 times more infectious, and I think maybe that's the impression I gave, and I just want to make sure I clarify that. Thank you for the opportunity.
Hey, Amy, another point of clarification. Katie Huff is our alternate health official. We had the wrong name originally, so just want to make that clear to our viewing audience.
Thank you, Mayor. With Hunhoffs and Huffs and Fricks and Mosiers, I get the names turned around sometimes. So thank you. Wanted to visit a little bit now with the health board about our ordinance. The commission, as you know, worked probably as hard as we did. They did their own surgery on the ordinance as we did, and they moved ahead and enacted that ordinance with a couple of changes. They did in the end take out things like veterinary service, chiropractic service, dentistry, those types of things. So those are still permissible. They did put in dog groomers as one of the restricted businesses. They also reiterated some of the back and forth that we had as a health board about hair salons, nail salons, massage therapists, those types of things. But those were put into the ordinance. So tonight is the second reading, and the PD will begin enforcement on Tuesday. We plan to have the ordinance printed tomorrow morning in the PND. That's all set up. The commission can make some changes. However, I believe Ross and I will be recommending that the commission not do that, because that sends another timetable forward, rather that they wait and see how this goes for a while. And then if they need to make changes more restrictive or less restrictive, they could do so going forward, and we could do special meetings for that. What we're hearing a lot of, and I think the commission is hearing a lot of, is folks are, the dog grooming folks are not understanding that. Also, we're hearing a lot from salon owners who believe they should be able to operate on a one-on-one basis. So I think it would be helpful for us to give a recommendation from the health board to the commission about any changes we think they should make or not, so that they can understand what the health board's perspective are. So I'll let you guys all chime in, and then we can see if we have any different recommendations for the commission other than what they're currently acting under.
I guess I would propose that we keep the recommendation as it is for now. You know, I think it's important that we get this ordinance enacted tonight so it's fully effective tomorrow. I think that's the bottom line here, is that even if we do need to make some adjustments down the road to what businesses are impacted, I think really the bottom line for us is we don't want people going out if they don't need to be going out. The longer we can stave this off, reduce infections, flatten the curve, the less lives will be lost. That's the truth of the matter for me. So that's where I'm at.
This is Mary. I'm in agreement with that. And I would say it seems that more of the evidence is coming out. Originally, they thought maybe it traveled only by droplets, which were bigger than 5 micrometers, and they have shown now that it definitely can travel by aerosols. There have been a number which are even smaller. They are easier to be carried so it doesn't take a big cough. It can just be breathing, and that it is able to get on services and be there for, at least 3 hours. So I think that the ability of an asymptomatic person, and I think what they find is that they have a large number of cases that are arising from asymptomatic people. And so a person could feel perfectly well, afebrile, go to a salon, and still be quite infectious. And that worries me because there's extended close contact. And with the definite proof now that it can travel by aerosols, that makes that situation, to me, more worrisome. I would also say that when we look at the cases in South Dakota, it's doubling. We went from 40 to 90, and I haven't heard all of today's numbers, but there were 4 reported now in Yankton County. And so we definitely have it among us, and I think that the asymptomatic carriers are of big concern. So I would still have reservations about changing that.
Just to build on where the numbers are at, like you said, Dr. Milroy, we are at 4 cases. The state is also saying that we are in the minimal to moderate range now for spread. So they're saying there's a single case of community-acquired COVID-19 in a county that is in the minimal to moderate range.
And,
So
and the break point is 5. So if we had 5, then we would be jumping up to high. In the high, if there were 5 communities spread, then we would be in the high. So the line is not very far away, I think.
And I think what I'm seeing here just now on Department of Health is the state's up to 101 positives, but still four in our county. So Dave or Jason or Ross, anything you would like to change in a recommendation for the commission tonight?
I think that we need to stick with the language as it is. We've spent most of the latter part of last week having productive conversations with our business folks, for the most part, just trying to get a better understanding of the language. And you know, from a technical standpoint, Ross, correct me if I'm wrong, but really the ordinance in the second reading should be either approved or not approved as it sits. And then there's a provision in there for a resolution at a future date. So if there's any language changes that need to be made, I think we'd be looking at, you know, a few days or weeks down the road for consideration of those language changes by resolution. You know, our contact with the business community, although there's been some people upset as we anticipated, just like we all are with the situation that we're in, you know, has been really productive, and really applaud the business community for their willingness to for the most part participate and be proactive.
I would echo Dave's sentiment that tonight, regardless of what recommendation this board gives, we should not suggest to the commission that they make any changes so that it can be enacted tomorrow. If we make any, quote, substantial change, that's the statutory buzzword, it requires that the commission wait an additional 5 days before they pass the second reading. So we would need effectively another second reading. Having said that, the one thing I'd like this board to consider is dog grooming was something that the commission as a whole added during the meeting on Tuesday, and was not something that this board recommended. So I'm actually personally, I don't feel any heartburn suggesting a recommendation that removes dog grooming, but not tonight. I think that's something that the commission, I think we could recommend to the commission for consideration at a future special meeting, if necessary. Just not, we don't want to mess with it, you know, and just to remove the words dog groomers or pet groomers from the ordinance doesn't seem like a substantial change, but for a business owner that's directly affected, I think whether they're in or they're out is a substantial change to those individuals. So rather than take the chance as to whether it is a simple change, we're better off leaving it as is, have it be published as approved tomorrow, and we could have a special meeting as early as called by the mayor or 2 commissioners.
Yeah, Ross, and I'd like on that point everyone to think about that a little bit, because we've made our recommendation, and it sounds like we're going to reinforce that recommendation this evening. We didn't have that in there as the health board. That was something the commission put in there. So if the commission wants to change it, they can. We already made what we recommended, and they changed it. So, and that's all we're supposed to do as a body. But I agree with you. I think we give you as the city attorney can give them that option. I don't know if, you know, we've already discussed the merits of that as a health board, and they changed it. So I think that would need to come out of their body. But I agree with you that tonight our recommendation should be they keep their language. Also, people are very confused. Many of the calls that I got were, am I open? Am I not open? Why is this person open and I'm not open? So any change is going to create even more confusion at this point. And I think we need to get our community to this new level of operation and get people a little comfortable with that before we start moving things around. And as the health situation, I think it's a little more intense. I think more people will be on board with the recommendations we made.
think honestly, as this situation develops and we have more cases, the dog grooming issue might become a moot point if we were to decide to go to more of an essential businesses list. So like Amy, I would agree with what Amy said, that it wasn't part of our original recommendation. I would be fine with removing that. However, going forward, we might be changing our recommendation may evolve as a health board. And in that case, I would expect they would be on that closure list as we look to limiting things to essential business.
Yeah, so on that point, unless Jason, do you have anything different other than what we've said?
I was just going to say that the dog grooming for me was kind of a, almost, do we really or not? But there is some transfer of equipment, not so much from the dog, but the leash, the collars, those things. So there could be droplets on that when someone's dropping it off. Plus, they're in a car usually with the dog while they're traveling to the dog groomer. So I think leaving it is probably good for now, and maybe seeing as how many cases we get and where we go from here, maybe pull back later on, but leave it in there for now.
Okay, yeah, and I stand by the fact that we've given them our recommendation and they can change it. They're the lawmaking body, so that's where I stand. If they want to potentially change it, we'll tell them the vehicle to do that. On that note of essential businesses, non-essential businesses, we know that we may have to take future steps, making future recommendations to the health board. So I'm working right now on what we would consider essential and non-essential. Ross and I need to spend some time on that this week. Should we need to make a different recommendation to the city commission? So I've started that. I'm thinking I'll have kind of a draft tomorrow, and then Ross and I can start looking at that with community development. And then we'll bring it to this board to talk about. Part of our big problem is going to be that many of our employers located just outside the city limits for purposes of, I presume, sales tax or property tax, and they're not within our jurisdiction. So that we don't have any ability or authority with them. So that's hard, but we're hoping that the county health board will work on some policies. I guess I'm hoping that policy stronger than recommendations for their employers. Anything else on tonight's meeting or our ordinance? There's going to be a Facebook Live, another Facebook Live event, which we're going to have members of this health board, probably community development, and either one of our PIOs, Todd Brandt or Jason Foote, talk a little bit more about the ordinance, and then also talk about enforcement, so people know that this isn't, just rhetoric. This is a legally binding ordinance, and we're not taking it lightly when people are not paying attention to the matters of public health in the situation. So we will be enforcing that, and it's not to threaten people, because that's not how our police department or any of our city ordinances are enforced. We don't operate that way. It's not a threat. It's hey, we need to work together as a community and all do our part to make sure that we're doing everything we can.
When will that take place?
Tuesday, tomorrow morning. Oh, the Facebook Live event, excuse me, that's this afternoon is at 4:30. There's going to be representatives from Yankton County and the city, and I think the medical clinic and the hospital as well.
Yep, and that will be streamed via the Yankton Office of Emergency Management Facebook page.
Yeah. So
Should we as members be on that, or just tune in and listen, or?
I think you can just listen, Dr. Milroy. I think in the future, they'll probably ask you to be one of the participants. My understanding is they're going to try to have different faces sort of every time. So I won't be surprised if you're asked at one point to be a part of it. I think today's message is going to kind of revolve around the cases that have occurred in our county. And then also we'd like to get more information out and education out about our ordinance and how important it is that people are abiding to it.
That sounds very helpful for people to listen to. That's great.
Hope so. The only other item that I had that I wanted to bounce off the health board is something that I've been working with with a department head and wanted to get your guys' thoughts. Todd Larson is our director of Parks and Recreation, and he has had a lot of back and forth in his field among colleagues about playground equipment. And the position that we've taken thus far, and I happen to think it's the right one, but again, looking to my resources here in the field, is that we are going to regularly clean the playground equipment and keep it open at the risk of everybody's use, just like we always do. You know, we typically clean it, not regularly, but we typically clean it, and then we let you know, the rain and those things take care of the rest. But sometimes we have an incident where we need to do some special cleaning. But my position on this during this period of time has been, let's keep it clean and let's have a little more regular cleaning, and then let's let people know this is at their own risk. My understanding is that ultraviolet light, i.e. the sun, will help to kill off virus if it's there. I think that's a good approach. I checked with some other larger cities. They're not closing their playgrounds at this time. They feel like letting people know that's at their own risk, you know, kind of a wash in, wash out. If you have your kids on the equipment, limit the number of kids on the equipment. But what are your guys' thoughts and comments?
I would be okay with leaving it open. And I think that it's in an open space. It's not an enclosed space. And I think with the outdoors and the temperature, the sun, all that, probably the likelihood of the virus surviving real long is probably decreased. And I think it's certainly the risk is there. So I'd say clean more often, having parents do some of the washing on and off. Bring some hand sanitizer, hand wipes, whatever, is a good idea, but I would not suggest closing the parks or the playgrounds.
I'm going to agree with you. You know, it's outside. We're trying to ask people to use social distancing, but yet they're going to need some place to go to go off. So the parks might be good for that, for young kids to get a little burn off energy, that is.
I think that, you know, we're having discussions that we never thought we'd have about playground equipment at this point in time. And it's, you know, I think that it's all just kind of a calculated risk situation at this point. And that to me would be one of those places or activities that would fall, you know, into a lower risk type of activity, as long as we make sure that people understand that they have some responsibility when using those facilities.
Dave, thanks for saying that, because I feel like we can give any recommendation to the city commission that we think is prudent. The commission can enact as many laws and ordinances, but people also have to remember that what you just said, they have to be responsible. They have to take responsibility for themselves as well. We're not going to be able to mitigate every possible situation, interaction. They need to, you know, they need to take the part as well. So if somebody's uncomfortable, then maybe for their family, that's not the right choice. But for those who do want to do that and utilize that, we think that it's, you know, can be performed safely, and they can go about their business on as they think is right for their family. But people do have to have their own responsibility. We just can't plan for every type of interaction, just like the sidewalk. I mean, we've asked people to pass each other with care and, not cough on somebody as you're passing them on the trail in Memorial Park. We can't prevent that if that happens, but we're asked them to take a roll. So, I don't know.
I'm sure we were all driving around a little bit this weekend with cabin fever here and there, and we all witnessed the public doing things, how we would and how our family is currently doing them, and then we all probably witnessed a few bad actors that maybe aren't taking this as seriously as they should, and with what the emergency management's doing with the COVID task force for education, I think is extremely important, and that effort needs to continue and maybe increase even. And hopefully we get a few viewers here in this discussion, and the people who are going to do the right thing are the ones that are asking questions and taking heed to what they're seeing both locally and nationally. And those are the people that are asking the most questions and are listening the best. But those are also the people who, probably need the least amount of encouragement to just do the right thing. And we just hope that at a certain point that the tide continues to change the mind of the potential bad actors, and they start to just do the right thing.
Thank you. Anything else anyone wants to talk about? Otherwise, I'd like to talk about, should we plan another meeting at the end of the week, or how would we like to go about that?
I'll just make one note. So there's this website called unicast.com, and they track cell phone data to determine if people are decreasing or increasing their movements, and they can break it down to the county level. And according to their latest stats, between March 23rd, so it would have been last Monday, and March 26th, mobility in Yankton County decreased by 34%. So that's moving in the right direction. Thank you.
Yeah, thank you. That was interesting. Thanks for sharing that. It was interesting to see.
One thing for you guys to think about, we talked about if we need to do another layer of this, a non-essential services or businesses closure. The easiest way to do that for us would be to add to the list of businesses that are closed under paragraphs 1 through 4 of the ordinance, and then add to the list of businesses that are not closed under paragraph 5. I think it's going to be easier than starting with a new ordinance with its 5-day second reading limitation. We can take the next step if and when that's required much more easily if we just modify our lists, and we can do that with a recommendation from this board and then just a passage of a resolution by our commission.
Ross, will you mention that tonight to the full commission about what that could look like if we were to do that again?
Absolutely.
Helpful for them. So, what do you guys think about maybe tentatively scheduling a meeting for Friday morning or Thursday afternoon in case things change rapidly? Thursday afternoon gives us a little time. If we need a meeting on Monday, we have Friday to get things put together and over the weekend, but.
Yep, that sounds great.
Thursday after 3 works good for me.
People watching may wonder about our discussion of going the opposite direction. When do we start easing restrictions? And I don't know about the rest of you, but I've been starting to see different healthcare experts, public policy experts put together plans on how you might be able to consider that. And so I think down the road, those are the kinds of things we'll start looking at, triggers for when we can start relieving these measures. Keeping in mind, we might have to increase them and decrease them based on what's happening on the ground. But from everything we're hearing, that's at least a month out. Even the president has extended his guidelines through the end of April. So unfortunately, it doesn't sound like we'll be moving that direction anytime soon.
We're already looking into reopening I guess, strategies or, things that other states are seeing or other countries. So we'll keep monitoring that. That's one nice thing for us is we had a little more time than some maybe other states did, and we can learn some best practices as well. I'll remind everybody today that the legislators meeting to discuss some amendments as well. So maybe some of the things that we've done, we have a little more assistance from the legislature in terms of authorities, et cetera. More actions need to be taken. So that's probably more useful to Ross than anyone, but just so folks are aware of that. I'm looking at Thursday, April the 2nd at 4 p.m. I'm seeing a couple heads nod.
Okay, by me.
Okay. Jason, how does that look for you?
Good.
Okay, let's plan for that. And if you have agenda items, you can email them to me before. Otherwise, it might just be a shorter discussion like this, which is okay too. And maybe that's hopeful, but that's okay too. We'll just stay in touch that way and plan for that. And if our discussion then requires us to take some movement, we can work on that. And, if we need another meeting of the commission, something like that, we can have that Friday then to get that prepared. Yes, Ross?
I'm getting some texts. To what extent do we want to allow the Facebook, I'm sorry, not Facebook, the YouTube video comments to filter up to this discussion? I'm getting texts.
We've talked about that. Sorry, we've talked about that, Ross. My position is that this health board is not under South Dakota codified law, public meetings law. We don't have to provide this YouTube live feed, but I felt in the interest of transparency that it was beneficial for them meaning the public, to be able to watch this if they were interested. We make a recommendation to the commission, and the format for the community to provide comment is to go to the commission meeting or participate on that live chat function at the commission meeting, since we don't take any action. If there's items that come out from a chat that you want to bring up at a future health board meeting, I think that's fine. I just don't want to get into us responding like the commission, because I think we're basing our recommendations on what, our expertise is, and not opinion and not political pressure. I mean, our recommendations have to be strictly based on best practices, information, Dr. Milroy's medical knowledge, the knowledge of community development. We're seeing I think that no one's saying anything, so I guess that means they are okay with that. But if you want to share something, Ross, for our next agenda, I'll put it on.
I was just getting individual texts, and I think that explanation was just helpful for the people who are listening.
Okay. Awesome. Well, with that, I would get a motion to adjourn the health board meeting and remind everyone there is a special city commission meeting tonight at 7, which will be live streamed as well if folks want to watch that. And that's a meeting where we will take comment and.
All right. Thank you.